Ajay Kumar, I'm Chief Clinical Officer for Hartford HealthCare. We're going to get started with some of the details regarding the number of patients we're caring across the Hartford HealthCare. At Bacchus Hospital, we have 3 patients who are COVID positive. Charlotte Hungerford has 1 patient. Hartford Hospital has 26 patients. Midstate Medical Center has 7 patients. St. Vincent Medical Center has 19 patients. Hospital Center Connecticut has 12 patients, and Wyndham Hospital has 2 patients. Total 70 COVID positive patients across the system. There are about 12 or so on ventilator, and we've seen as I had mentioned, a continuous decline. Last 3 days, we've had the numbers about 68 to 70, the same number across the Hartford HealthCare. In our behavioral health network, we had 2 patients last week. We have none at this time in our COVID only unit. And community network has 94 patients. We'll be talking a bit more about the community network and some of the work later on as we go forward today. One of the big change we had in Hartford HealthCare, keeping with the principles of safety and our as we are going to the new phase of recovery at this time, we have relaxed our visitor policy. Our processes such as infection control, our auditing or making sure that everything else is going very well, our screening process, cardiac testing, increased amount of testing we're doing for the patients who are getting admitted to the acute facility has allowed us in positions differently. And right now we're pleased to have those visitors be part of the care process at this time. There are some cautions, obviously. We want to make sure that it's a phased approach, it's a slow approach, it's a thoughtful approach. What we are doing at this time across the Hartford HealthCare is that individual patients actually can come along with their escorts or companion for surgical procedures, and procedures require some sort of a sedation or things like that. And gradually this week and next week, we'll be rolling out a relaxed visitor policy, which is allowing one visitor to accompany a patient in the acute setting. We're still being cautious about the COVID patients or patients who are under investigation as a positive, only because of the risk to the community and risk to the visitors as well. So we're going to review that later on, but right now for the non-COVID patients, 1 visitor will be allowed to visit in the hospital. We're not allowing anybody who's less than 16-year-old. Every single visitor actually would have a mask. And there are defined visiting hours across the system where individuals can visit at this time. All the visitors will be screened at the doorstep for the temperature. We'll be making sure that they're not febrile, there's no symptoms before they allow entry into the system. For those patients who are COVID positive and PUI, we will still review case by case and make some exceptions based on some unprecedented scenarios, and we will still evaluate. But we feel confident at this time where we are in this opening the visitor policy. Regarding the emergency rooms, they're a bit more complicated, as you can imagine. Sometimes waiting room gets crowded, so we want to be very mindful and thoughtful. And every single ED across the system has a plan. By next week, Monday, we will be allowing visitors across the system, and obviously require some modified waiting areas and things like that, which we're working on as we speak. So that's the one change we have. This phased, thoughtful, and disciplined approach will allow our caregivers and family members to be more part of the treatment, as we always like to be doing. Regarding the COVID, I think the question has been coming up regarding the demonstrations and the large gathering happening. How do we see, or how do we read into that, and how do we prepare for that? So I think these are always a concern. Any large gathering, any large congregation of people can lead to infectivity. This virus is as infectious as it was in March, so we have to be careful. What I'm encouraged by is that majority of the demonstrators are wearing masks. Social distancing or physical distancing is rather challenging. So we will see over the time what impact it has. I think these are the things which have to keep an eye on that and manage as we go forward. Regarding COVID, a few other things. Remdesivir, we got the 3rd tranche of the supply last week from the state. We're very grateful for the state's effort in getting the remdesivir for our patients, and we're using it for the right patients across the system. Convalescent plasma, we continue to have a good support. We have close to 500 donations of the plasma acquisitions. We've treated more than 350 patients across the system at this time, so we continue to use that convalescent plasma at this time. And we are eagerly waiting for the new development, whether it's a drug or vaccines, as it comes forward. Going forward, what we can expect, I think the couple of things I've said that all along is that we would have some patients who are COVID positive throughout the summer in the acute hospitals and across our community. We're going to have to just manage and make sure that we non-COVID patient population is managed as safely as we can. Our testing is going to continue to get optimized. We are going to continue to have increased amount of testing. We already are doing almost 2,500, up to 2,500 of testing every day in Hartford HealthCare. So we're going to continue to expand on that as we go forward. Our internal Hartford HealthCare process on contact tracing, managing any hotspots or outbreaks or whatever else is very robust right now. And we continue to be very proud of our teams, how they've managed this very well. As we move into the next phase in state, I think these are the focus. So I would imagine we would have to focus as a healthcare community to make sure we contain the virus. As we talked about the predictions in the fall and the winter, at least I expect some sort of a surge in the fall and winter. However, it would not be as pronounced as what we have seen. So Connecticut, I like to believe, is well prepared, well positioned, and our healthcare systems are well planned out as well. We're already looking into the winter planning. We're looking in the PPE supply and how the different policies will be reenacted, and we'll work on that. In Hartford HealthCare, we continue with the travel ban, no business travels for the healthcare colleagues. This is to really protect our colleagues from contracting any COVID from travel-related issues, and even protecting our patients and community member. So these are the few things we're doing at this time, and we'll be continue to keep you updated as we go forward. With that, I have a colleague of mine today who's joining us, Laurie St. John. Laurie is Vice President of the Hartford HealthCare at Home, and she'll be talking about the safety in community network, and especially at the home care. Thank you.
Hi, I'm Laurie St. John. Safety for the whole system has been a core value for both Hartford HealthCare and Hartford HealthCare at Home. Our staff and our patients, really, their safety is our priority. So during COVID, we really ramped up our efforts. For instance, every Hartford HealthCare employee has a temperature check and a COVID screening, every single day before they come to work. Our patients in home care, we make telephone calls before our clinicians go out to screen them. And then when our clinicians go into the home, they do another screening. They do it 6 feet away, just to make sure that any equipment that we need, any protection that we need for both the patient and our staff is used. We also strictly adhere to the CDC guidelines for PPE. We've been very fortunate at Hartford HealthCare and in home care that we've had no shortages, so that has really been a blessing. The other thing that we do is we always make sure that our clinicians, any equipment they bring in the home, when they leave the home, they clean it all before they go to the next patient's home. So I'm really proud of our staff and our clinicians in Hartford HealthCare, because throughout the pandemic, they continued to work to take care of our patients, and in home care, keep our patients safely at home.
Thank you, Laurie. At this time, we'll open for any questions.
Hey, Dr. Kumar, this is Emily from The Current.
Hi, Emily.
I wanted to ask a bit about Hartford HealthCare's contact tracing process. Does the hospital system do its own contact tracing of patients who test positive? Can you explain a little bit how that works?
Yeah, thank you. Yeah, we do it our own contact tracing. So what happens is that there are two different aspects. Is that if suppose any of a colleague turns out to be positive, they have symptoms and they get tested and they're positive, our contact tracing team, infection control team led by Keith Grant, make sure that all the contacts in the last 24 to 48 hours or whatever the time duration he is thought of in that particular scenario is reached out and connected, and then we do test individuals who we think are suspicious, who might have contracted or may possibility. We take them out, obviously, for the work duration as well, till we are certain that there is no further spread happening. Regarding the patients, if right now we're in a different place right now, everybody's got a mask, we are using all the PPE. So that's a very occasional, almost a rare event right now. If the patient actually comes in, turns out to be positive, and for whatever the reason, there was a possible exposure to any of the colleagues or any other member, we make sure that entire tracing is done all the way to the community or wherever we can make it happen. But that's a very rare right now because, as you can imagine, every single patient who comes in is given a mask. There is a precautions are taken from the get-go. So that's extremely rare. As we talked about, the COVID sometimes can present with a really non-COVID type symptoms such as flu and a variety of different things. So that the challenge we've had all along through the pandemic across the country and across any of the hospital system is that how do you differentiate if somebody shows up with a really, one of our colleagues comes up with a bad headache or things like that, you could very well be a symptom of the COVID. So you got to make sure you ask the right questions, you track it back, you explore what is the possibility of this individual being exposed to anybody who might have had a COVID-related symptom or positive. So that really detailed, laborious work gets done every single day, 7 days a week across the Hartford HealthCare. And that's one of the reasons I had mentioned in the past that we have not only a very strong infection control team, infection prevention team, but also we have extended this team and included more members across the Hartford HealthCare to be able to do this in a rapid fashion. So every single morning we look at the data 7 days a week. Regarding who's turning positive, if they are, and then we react accordingly.
And just to clarify there, with patients who test positive, if you do a contact tracing effort, that's within the hospital, not within the community? So you wouldn't contact for patients like their family members or friends or anything?
We generally not. That is not the capacity we have. We would ask the relevant question if any loved ones or nearby has been affected, so we would advise them to seek medical health. But we cannot go beyond that. We're not privy to be able to go too intrusive, let's put it that way, in the patient's personal journey. But we do ask the relevant question who's able to share.
Thank you.
You're welcome.
Hello,
Morning,
this is
Dr.
Dan
Kumar.
Corcoran.
Go ahead.
Thank you. This is Dan Corcoran with NBC Connecticut. I know you touched on this briefly before, but after another weekend of some really large protests, many leaders around the country are urging protesters who were involved in those gatherings to get tested for COVID-19. From a medical standpoint, is there a similar recommendation from your standpoint? And also just any other comments about the potential impact of these large, close contact, prolonged gatherings on the coronavirus spread? Thank you.
Yeah, so that's a real concern. I mean, as you can imagine, the large gatherings we have, especially without any precaution, would increase the risk, and we would have some increase in community spread over the time. I like to believe that Connecticut has already taken a position to get tested and get tested in increased quantity. So I would agree with their recommendation. Those individuals who have been protesting, and they should utilize the state's now evolved system of testing and get tested. The challenge we have right now, this is a complicated question to be answering, quite frankly. I think we've all struggled with that. The challenge is that once you test those individuals, it takes 24 to 36 hours or some time frame by the time the result comes in. And then there is a fair amount of exposure this individual, if somebody comes back positive, could have exposed to. So the contact tracing doesn't work all that well. So although you can test, and by the time you isolate, you might have still have it spread to some extent. So, and these are the complex and challenging questions we seem to have less of an answer because we don't have a strong enough contact tracing program across the country, and we do have some the time lag between the test is done and by the time the result comes back positive allows some exposure to happen. But at the same time, I think the more testing can only help at this time. It would limit, it would not eradicate, it would reduce the amount of exposures we have as we go forward. So the long and short of it is that if the answer to your question, yes, people should tested, people should wear a mask, and as much as possible, maintain a physical distancing while the protests are important.
Thank you.
Yes, Dr. Kumar, that was my question. You answered it. In addition, is there a time lag, not just for the testing, but for those that don't test, who may have been exposed and become ill, let's say a few days to 2 weeks down the road? Are you looking to watch for that kind of surge?
Yeah. So as you know, generally, as we've talked about, and I'll give you very basic stats on this virus, and since what we've learned from March, the incubation period of this virus is anywhere from 2 to 5 days. So if somebody gets exposed, from next 2 days to next 5 days or 6 days, we would have some sort of symptoms coming in. 80-something% of the patients actually may or may not have significant symptoms to be complaining about. 98% of the people, or close to 98.5% of the people will recover without a doubt. There would be a small percentage, 1 to 2%, who would actually require a hospitalization. So by the time you put this together, and it takes about 14 days for the disease cycle to kind of evolve and declare and get better over the time. So if you put all these factors together, if I was in a demonstration 14 days ago and I don't have any symptoms and I'm doing very well, more than likely you would not expose and you're good to go. If I was in a demonstration or in a close contact anywhere from 2 to 5 days from now, I don't know whether I have it or not. Probably good idea to get tested at this time. But if I was in a demonstration yesterday and I'd like to get tested today, it's probably not a whole lot of point, because it takes about 24 to 48 hours by the time the test actually may become positive. There's a fair amount of false negative you might actually have. So these are the complexities we're dealing with right now with this virus. So essentially, we like to see, the way I'm reading it at this time is that, Connecticut, I like to believe we've actually, the state has done a really good job still with the demonstration. It's not as what we're seeing the photo pictures coming from Washington, D.C. and other places. The crowds are large, but they're outside. Generally, they're all, most people are wearing a mask. There's not a whole lot of, I'm hoping that there is a disregard to a personal distance to a significant extent in Connecticut. So if you think about and the demonstration didn't begin the day after when Mr. Floyd passed away. It took several days. So we still have within 14-day window. So by the time the 14 days comes around, the way the metric I look into that, what is the hospitalization rate is looking like? Is it going to go up? Is it going to stay where we are right now? And the next week will be critical for us to know, and we will see how it becomes apparent. So we'll be looking at the data very closely, and we will be monitoring how the system evolves. I hope that answers most of the answers you have for the questions you posed.
Yes, thank you.
Thank you. Any other questions for me or for Laurie? Tina, anything?
Nothing.
Very good. Well, I appreciate you being here, and thank you very much. We'll continue the conversation every day, and look forward to sharing whatever we learn as time go by. Thank you.